Now let's discuss some of the important questions that might come in your exam. So how do we determine the side of radius? To determine the side of radius, it should be noted that the proximal end has a disc-like head, whereas the distal end is expanded. Medial border is the sharpest and presents the radial tuberosity at the upper end. The posterior surface at the lower end presents a tubercle called the tubercle of Lister. How do you know if a radius is of left side or the right side? Locate the anterior aspect of the radius bone. Then you will look for the radial tubercle at the proximal end. This will point towards the side of the body. This bone belongs to it means it is present medially. That is, the right radius will have the radial tubercle on the right side. Should I move my fingers with the broken wrist? Your wrist is broken, but your fingers are not. But that doesn't mean your hand is strong enough to carry out the weight-bearing activities. You can move your fingers, often to reduce swelling and stiffness, but do not use the hand to grab or carry anything. Follow instructions for exercises to keep your arm strong. How long does it take for the radius fracture to heal? Fractures of the distal radius usually need about 4 to 6 weeks for the clinical bone healing, though sometimes it can take longer. It may take another 6 to 12 months to regain motion, strength, and function. I think we have discussed all the important features of radius and its association with other bones. I hope now you must have sufficient knowledge about this bone that you can jot down on paper. It could also be an exam paper. So stay tuned with us to learn more about the important subjects you want to improve. Thank you so much. Keep watching sqadia.com.